this is a 3-week-old neonate. This in 2006 I treated, had a history of classical neonatal sepsis, NICU hospitalization, and then presented with decreased movement and fixed flexion deformity. On a closer look, there is a right septic hip dislocation as well as the osteomyelitis of the proximal femur. And as the previous speakers also have mentioned that I went on just doing the drainage and giving the joint wash, and then for the containment and stability, I gave the hip spica, which was followed by the 3 weeks of IV antibiotics, followed by the abduction splint. We usually give abduction splint for a couple of months so that we give the stable hip. Post-surgery period, the pain subsided and the movements were quite improved. And if I see the X-ray, I was quite happy, and I thought that this hip will be as good as a normal hip, because if you see the hip, the right hip is well contained, as well as the femoral epiphysis also looks quite good, you know. And then the child was kept under follow-up. This was a picture at 2 years, and then this was at 4 years. You see, there is definitely enlargement of the femoral head, and the coxa magna has started developing. This is almost 6 years down the line, and one can see now definitely there is a it is Dr. Johari's type 4, where we are getting the coxa magna, and as well as some degree of valgus also, which is there. And there was a lengthening of half centimeter. Patient was not very symptomatic, and parents were happy. And even I was not thinking to intervene at this stage, because he has no symptoms. So he was doing almost all activities, playing and all, no difficulties. Now this is a picture in 2013 where coxa magna progressed, and now there is definitely a problem of coverage. At that time, this time in 2014, I thought that we need to do something, because otherwise this hip will have some problem. But since the child was still asymptomatic and parents were really not willing for surgery, I just asked them to just keep a follow-up. And this was in 2019. Now there is definitely the symptoms started. The child started getting difficulty on playing sports, and he was getting little discomfort as well as a pain. So maybe some degree of instability as well as this coxa magna is creating trouble. And now I could convince the parents. So the varus osteotomy was done. It was in 2019, right? So, and in simply varus osteotomy, I could get a good coverage. So as Dr. Zohri sir has previously mentioned, when we took the child, I decided that if required, I can do even some kind of acetabular procedure as well. But since with varus osteotomy, I was able to get a good containment. So we decided just to do the varus osteotomy itself and not doing any acetabular procedure. This is after 2 months, and this is a union at osteotomy site. And this is after implant removal. This is a 2-year follow-up. You can see the containment is quite good. The patient's symptoms disappeared while playing sports and all, like high energetic active. Whatever the pain or discomfort he used to have, it just subsided. And this is the gait of the child. So it is down the line now only 3 years, which is post-op surgery follow-up. So the message from this case, I think, is one has to keep these babies in a long-term follow-up. Even they are in immediate post-op period, they are looking okay, but we have to keep a very long-term follow-up of these cases. And varus osteotomy is one of the good option for coxa magna.